Hi everyone. Today we will be discussing integrated approach to medicine. Now what is the integrated approach? Now in today's scenario integrated approach questions are being asked in NEET PG. So they will give you a question in which they will try to correlate the two or three subjects or maybe four, depends on the question. So I will be discussing one of this type of integrated question today. A 50-year-old male came to OPD with complaints of dysphagia. On investigation, it was found that he is HIV positive. Next, his endoscopy was done, and following results were obtained. Identify the likely cause. So, what were the results? These were the results. This is the actually histopathological examination slide which they have obtained after the investigation. Now, what are the options? Option is Pseudomonas infection, Candidal infection, CMV infections, and herpes infection. So now as this in the question it is given, we have to find out the important things which will help us to crack the question. So what are the important things? 50-year-old male, dysphagia, and HIV positive. So like this we have written 50-year-old male, dysphagia, complaint of dysphagia, and he is HIV positive. Now you know that in HIV CD4 count is decreased. We all know that. So he is immunocompromised. Now, next hint comes from where? This slide. Now, see this slide. What is the typicality of this slide? Dense central part and peripheral clearing. There is a peripheral halo or clearing, dense basophilic part with peripheral clearing or peripheral halo. It is a clear-cut indication towards the inclusion bodies of CMV virus or cytomegalovirus. So it is a slide of CMV infection. So my ultimate aim is that you should remember this slide. So I I will be telling you some of the important points. What about this slide? You will never forget this. So what are the important points? Look this picture I have made it. This is owl's eye inclusion bodies. See this here. Looking like owl's eye, densely basophilic with clearing, and also these type of cells are also seen in Hodgkin's lymphoma. Okay, remember read Sternberg cells. Now see this image. This is the image of owl in which you can see that the central part of the eye is dense and this part, peripheral part is clear. It is not dense. The peripheral part is clear. So dense with clearing. So whenever this slide was firstly seen by any pathologist, they named it owl's eye. So remember there are two owl's eye in pathology. One CMV inclusion bodies and read in Sternberg bodies. Read Sternberg cells. Remember this. Don't forget this. So these type of questions are being asked in NEET PG, in which you can see they have integrated three subjects: pathology, medicine, and microbiology. They have integrated all three subjects. If you have knowledge, overall knowledge of three subjects, then only you can answer this type of questions. So I will be continuously discussing this type of question, integrated question on my channel. So I will request you to like, share, and subscribe. Thank you and thanks for watching.